All right, welcome back to In the Kitchen with the Plant Based Nutritionista. I am Ethel Richards, and I'm so excited today to have Dr. Alicia Forbes with us to chat a little bit about her career, how we met, what she's doing now. But as you know, this podcast, In the Kitchen with the Plant Based Nutritionista, we talk about all things health and wellness. We don't just talk about eating more plants, which I inspire all of you to do and encourage you all to do, but we talk about the entire infrastructure, the system that surrounds how we make decisions about our health. And also today, what we want to do is lean into this spirit, this season of graduation. We've got a lot of people graduating from all levels: kindergarten, 5th grade, 8th grade, 12th grade, college, grad school, doctoral programs. You might be graduating from a trade school. This is just a season of celebration from like May to June, depending on where you are in the nation. And so I thought it would be so awesome to have Dr. Forbes come on and chat with us today a little bit about her career, how she even got into pharmacy, and kind of just expand the minds of our graduates to consider all things in the field of pharmacy. But before we get there, I want to just drop some just amazing information about what this woman has done over the years. Let me tell you guys. So she went to, let me pull it up. I have it right here. She went to Texas Southern. So shout out to all the Texas Southern people out there. She went to Texas Southern University College of Pharmacy and Health Sciences. And from there, she did some amazing things, held leadership positions, teaching other pharmacists in training. And now she's doing some great work with the VA. But I'm going to leave that to her to talk a little bit more about, and also encourage you to go over to YouTube and look at the bio in full for yourself. By the way, if you haven't yet, subscribe, like, follow, whatever platform you're on. We love to have you because we have a lot of great work going here, creating this community in health, where we're just here to inspire and empower one another to own our health and to take it back, of course, one meal at a time by eating more plants. So without further ado, ladies and gentlemen, boys and girls, especially graduates, let's welcome Dr. Alicia Forbes. Alicia, thank you for being here today. How are you?
I'm good. Thank you for having me. I'm super excited to be here.
I'm so glad to have you. So I think we should rewind. You know, we're in our kitchens virtually, and at least my kitchen. Let's tell people how we met.
So many years ago, we won't say how many, you and I both went on a medical mission to Australia and New Zealand, learning about their medical field. I think we were kind of in between maybe high school. I think might have been an undergrad, but I think it was like between high school graduation and undergrad, like that time.
I think we were freshmen. We had just finished our freshman year or something in college, right?
So, yeah. So just finishing freshman year, totally new and naive, not really knowing what we want to do, but they had this medical mission where you just go to different countries. They form little groups. You have to give a presentation. Like I said, ours was Australia, New Zealand. Love learning about that. I remember one aspect was the indigenous people, how they used herbs. So I think that definitely fits into, what you're doing now, just bringing the natural products or natural plants and seeing how they can use them to better people.
Yeah, that was a lot of fun. I think I remember when we talk about the indigenous people, when we were we were in both places, but actually when we stayed overnight with the Maori people in New Zealand.
Yes.
That was so transformative. The food was great, by the way. The underground smoke pits and ovens and stuff.
I know.
Was really good. I can still taste the yams, the sweet potatoes.
I just remember all the breads and fresh fruits.
Yes. There was a lot of fresh fruit. And I think it was the first time I had ever seen bicolored corn that was edible.
Yes.
Mostly in the States, it comes out like once a year and it's decorations. But when we were there, they legitimately was like, "Hey, you want some corn?" I was like, "So I can eat this?" And it was like, "Yeah, you can eat it." And it was like bicolored corn, and it was so good. And it was still in the husk, and you pull it back and all that. It was very memorable. And then sleeping there was nice, still on the floor. We had little cots, but That was very interesting.
It's like one big, large room, women on one side, guys on the other side. I think they might have had our facilitator people down the middle.
Down the middle, yeah. Yeah, we may have been freshmen in college going into our sophomore year, but we were definitely still like 18, 19. Oops,
Yeah.
I told our age. So anyway, we were definitely still teenagers, so very much still curious about just, being mischievous.
Yeah.
So I'll leave it there. And then in Australia, I remember we didn't, I don't remember we staying over, but I do remember, I think we did some sort of tour one day where did we hear their story or am I combining stories? But I felt like we did something indigenous with the Aborigines too. We just didn't stay overnight. I can't remember exactly
Yeah,
what
we
it
didn't
was.
stay
So.
overnight, but I remember them like playing the didgeridoo. And like it was a whole program where they played the instruments. I think they showed us how to throw the boomerang, things of that nature. Yeah.
Yep, you're right. So that was really transformative because I walked away from that experience just having, I'm going to say gusto for the realities that we can do better. Like we went to the Sydney Children's Hospital. I mean, rooftop stuff we're doing now. They were doing 2 decades, if not more ago,
Yes.
incorporating complementary medicine, just, garden, outdoor time, no matter how sick you are. It was very transformative. And I came back realizing that we can do better. So I've kind of been on a mission, if you would, to figure that out. And I think I've landed where I need to be to support that journey. But more than anything, we were all trying to figure out what we were going to do after graduation. Even though we were going into our sophomore year, there was just a lot of buzz about what we were going to do. And some of us were going to medical school, some of us were going to dental. In your case, I think maybe one other person, I can't think of his name, it's a tall guy, was really adamant about pharmacy. And I remember Xavier. So why don't we start there? Tell people a little bit about, just take us from maybe Texas Southern to kind of, where you are now, I guess.
Okay, well, I'm gonna back up one little step.
Okay.
So before I got to Texas Southern, I did undergrad at Loyola. So I had a bachelor's in biology, minor in computer science, because at that time, I wasn't fully sure about pharmacy. I knew medical field. So I was just doing kind of generic pre-med. So I decided pharmacy school kind of sophomore, junior year, and decided to go ahead and finish my undergrad degree and then go to pharmacy school. Right now, you can actually do about 2 years of just the prerequisites and then apply to pharmacy school. So I decided to finish my undergrad degree. And then since I was doing that in Louisiana, I actually had to take almost a year at community college back in Texas, just getting all the different subjects. I did world history, and pharmacy schools wanted US history. So just picking that stuff up. And then I applied, got in. Even in pharmacy school, it's 4 years, P1 through P4. They have changed it some where we didn't really start clinical work. So in the hospitals, in the clinics, we didn't start that until our 4th year. But they're trying to get students more involved earlier on. So they even start with their P1 year, they go in shadow, if we get an internship card, if you're working at the local, like CVS, Walgreens, what have you, you can work under the pharmacist there and counsel patients, little things like that. The only thing I knew about pharmacy at that time was retail and inpatient, because I had actually volunteered at one of the local hospitals in the pharmacy department. Kind of fast forward to my 3rd year in pharmacy school, we had a guest speaker. She came in, she was talking about what she does, which is what I do now, where she's actually in a clinic. She sees patients face to face. If they have uncontrolled blood sugars, blood pressure, cholesterol, they're on a lot of medications, the provider can refer them to that type of pharmacist. And then they'll meet individually with them to educate, adjust medications. I'm like, that is so interesting. That's what I want to do. So I talked to the coordinators, and when I went into my 4th year, I asked to do that type of rotation early on so I could see if I really liked it, fell in love with it. For a lot of these specialty type of pharmacy positions, you actually need to do a residency. So you graduate your 4th year, you pass your board, so that includes just general pharmacy knowledge and a law exam. So I did that. But before that, I knew I had to do a residency. So I applied, did different interviews, and residency is similar to what they do for MD, dentistry, things of that nature, where it's just a 1-year focus. Well, for pharmacy, 1 year, I know. Other disciplines, it's 4, 5, 6, 7 years. But for pharmacy, you can do a general 1-year residency. I knew I really wanted to focus in on AmCare or primary care as a pharmacist. So I sought out residencies that had that AmCare focused. So for me, I was just able to do that 1-year residency, went up to Madison, Wisconsin, did that. And from there, I went over to a different hospital, kind of worked inpatient and did some solid organ transplant, and then wound up back in primary care. So just from that, and the one thing I didn't realize is that there's so many aspects of pharmacy. So there's, the retail pharmacy where Walgreens, CVS, all of those different places. Then you have the inpatient pharmacy, which works similar to what you would see, what we're used to seeing. They're processing the medication orders, looking for interactions, things of that nature. But then from there, it just expands. So within the hospital, you can have emergency room pharmacists, you can have critical care pharmacists, you can have cardiology pharmacists, you can have transplant pharmacists. It's almost kind of like the sky's the limits now. And then I do like on the outpatient side, so I'm just kind of general primary care. You can also have mental health, pain management. There's geriatric pharmacists. We've got pharmacists in industry. Let me think. I know I'm forgetting stuff. There's radiology, nuclear medicine. So it's a wide expanse of the different areas that people can pursue in pharmacy.
Wow, thank you for that. And like I've told you before, I'm so proud of you. Like this is
Thank you.
it's just amazing when we talk as we were still kids then, and then see where we are now. It's just like mind blowing. We are Black history, we are making history, and it's just so beautiful to see. So again, I'm proud of you. Congratulations. This is awesome. I was thinking so much about May and graduation, and we had some laughs about my nephew going to his prom the other week and just some of the fun things that they do this time of year. But it is such an exciting time. And, most people, aside from what you just said, most people really see pharmacists as retail, like you said, the Walgreens, the CVS, Rite Aid, supermarkets, things like that. But what you're telling our grads is like, hey, you can do a little bit more. So could you maybe talk a little bit about some of the courses you took in undergrad that prepared you for pharmacy school? Because I feel like sometimes in undergrad, like you say, you're still kind of undecided sophomore year. You're just still trying to figure things out. Some people don't declare a major until their junior year in college, but they're kind of tracking along and taking courses. So they're not there for a 5th year. But what are some of the courses? Is it the same as med school? Is it different? Talk to us a little bit about that, maybe.
Yeah, so I found that it was the same as med school. So your general biologies, your general chemistries, which also includes organic chemistry, not a favorite for anyone. Also, we had to do immunology. So looking kind of, at the immune system, cellular level of the body, anatomy, physiology. I think those are kind of the general sciences, and then just kind of the common core, the English. I remember I did have to pick up a speech class, history classes. I think for the Texas schools, they also wanted government, so I had to do government. So kind of just those general courses in addition to the science courses.
Okay, that's helpful to know because I don't even think I knew that part. I knew there were some similarities, but I wasn't sure how similar. So when you got to pharmacy school, one, did you feel prepared? Because the classes they take a whole 180 turn. I just know from talking to my friends in med school, like, what? So it's a whole different shift. What are you focusing on in pharmacy school? And my follow-up question is going to be, in case you nail this and you answer what I'm thinking is, does pharmacy school talk a little bit about, healthcare disparities and how to work with, how to interact with patients from different backgrounds? Did your program focus on that? I know that's budding. I'm sure it's taken off by now, but at the time, I'm thinking 08, 09, that was something that was starting to become more a part of the pharmaceutical curriculum. So what can you tell us about that?
So unfortunately, when I went to pharmacy school, we did not have any courses looking at equality, disparities, anything of that nature. I've kind of picked that up more in my career now, where I am. They have different learning opportunities. So I've kind of picked that up along with throughout my career and not so much in pharmacy school. But I definitely think they are trying to incorporate it into pharmacy school and even residencies. I know we were doing some mock interviews for some of our residents, and we actually asked them some of those equality questions as part of their mock interview. So I definitely think there is that shift to try and bring that more into the education. And as far as getting into pharmacy school, I think for me, I did feel prepared. It was a big wake-up call. I think for me, having had, 4 years of undergrad and then another year of just kind of picking up the basics, I was kind of on the older side where, if somebody's coming out of high school, they do those 2 years of their prerequisites and then they're going into pharmacy school. I had a lot of education where I'm just like, I'm kind of getting tired. Let's get this going. But as far as pharmacy school, we had a lot of courses, where maybe 1 to 2 courses that were specifically on math, calculations. We do have to, calculate if we're making, say, like a cream and we're putting a medication in it, then we have to know how much of the medication versus how much of the cream to make it a certain percentage. So we had calculation courses. We had general kind of pathophysiology where we're talking about the normal circulatory system or the normal pulmonary system, like what does the normal body function look like? And then what should we be looking for when there's problems? And then we also had our pharmacology classes where we're getting more into the in-depth of the medications and kind of also chemistry, looking at their structures and how this structure is beneficial or not. I think we also had a statistics class. Not everyone's favorite, but we did have
memories.
Yes. We did have statistics. We had like drug information, just kind of general. If you had a drug information question, how best to go about answering that drug information question. What else did we have? I think we had one course on kind of business where we had to put together a kind of business proposal for developing a clinic or something of that nature. I know they have been kind of changing the courses, so I don't know exactly what they how they've shifted them now, but those are kind of the general courses that I had. And then obviously our 4th year, we're on rotation. So our rotations were 6 weeks each. I did a management one. I did the outpatient clinic. I did critical care, retail. What else? Oh, I did infusion. So when patients have some infection, they get discharged from the hospital and they have to go out on outpatient IV antibiotics, so intravenous antibiotics. In that setting, they have little balls where the medication goes in the ball, and there's a tube. The patient will then hook it up, and then by gravity feed or some other mechanism, they get that medication. So that was kind of interesting where I did that. Also did like a really small hospital where it's, the pharmacist, maybe 2 technicians, and you're, looking at admissions for patients discharged. Were there any medication changes? I think that kind of covers the rotations that I did.
Wow, that's great. And it sounds like a well-rounded experience. And I'm so grateful you shared that, because I don't think a lot of people know this about pharmacy school, essentially. I know I heard a lot about med school, dental school, because I was more in that space, but pharmacy school, I had no idea. All I knew at the time was, oh my gosh, pharmacology. No, thank you. But listening to you now, I realize some of the classes are very similar in terms of training to be a clinician. Like that pathophys is interesting. That's what I'll say. It doesn't go away, but rightfully so. Yeah. Yeah. So I'll leave that there. But I'm thinking about the 8th grader, the 12th grader, the college student, the grad student who's trying to figure out, I'm doing this, like you did that year of classes. What do I do next? And I think hearing this could help someone make a decision like, what, I haven't considered pharmacy in that way before. Let me do that. Or I can handle those classes. I think there's that unknown fear, or that unknown, like I had, like, oh no, pharmacy, all I hear is biochemistry, chemistry. And I'm not getting away from it, by the way, nutrition. So it found me regardless.
Yes.
It found me. And, it's not as bad. I was just freaking out for no reason. So, we wanted to come together, Alicia and I, and talk to you guys about this, because we need more Black pharmacists. We need more pharmacists of color, period, who understand, one, what it's like to do life as a person of color, but also to be able to communicate medications, needs. Like you said, education is so important. There are so many people who have uncontrolled fill in the blank, which is what you deal with all day in the PACT team, right? When we say PACT team, guys, we're talking about basically, your primary care squad that's helping you out. It's your social worker, it's your nutritionist, it's well, actually, they have dietitians on that team. Your dietitian, it's your pharmacist, it's your doctor, it's the nurse, it's everybody involved with your care. But I think what we're trying to paint a picture is how important it is to have people that represent and look like you. One, to let you know that you can do it. Alicia and I are very young, and we hope that an 8th grader or a 12th grader or even somebody in college right now, grad school, is seeing this and saying, you know what, I didn't consider pharmacy. Let me consider pharmacy, because there is a lot. And I've ran into a couple people recently actually who've done industry, and I was like, so what exactly do you do for this consulting firm? And it blows my mind that, oh, I had no idea that a pharmacist would even be on the radar for that. So there are lots of careers, is what I'll say, in the medical field. It's not just the physician or the dentist or the nurse. You can become a pharmacist, and don't let the classes she shared scare you. They're really not that bad. They're really not that bad, actually. It's just a repeat of the foundations, really, with case studies, right? It's kind of a nice way to sum it up.
Yeah, and I would say find a good group of friends. That definitely helped me throughout pharmacy school, where we would meet up, we would study together, we'd go relax, have fun. So try and find that core group of people that you connect with, pharmacy school, whatever you're trying to do after graduation, try and have that core group where you can share your wins or your not so good things. And they're right there in the trenches with you.
You nailed it. I love that you talked about the spirit of community when we're going through school. And I'm in my clinical nutrition training now, and that I think has been the defining moment or factor for me, is having that community where I can say, and this is like, Ethel would have never said this 10 years ago, but I can say like, oh my gosh, guys, I think I'm failing miserably. Did anybody get this? And when you put it out there in the WhatsApp, where you realize everybody's potentially struggling with this concept, and then you come together and say, are we overthinking this? Did we misunderstand? Who again? And you start putting pieces together from everybody's understanding of it, and then you realize, oh, we are definitely overthinking this, or we probably need to talk to the professor, or just having that support, knowing that you're not the only one that's stressed right now. You're not the only one that wants to go home and cry. So
yes,
it's that kind of experience. I'm so glad you hit on community. So when we think more about community as students, what would you say? I want to kind of make it a little bit progressive. So we'll start with the eighth graders. What would you say to the eighth grader who's probably not even thinking about pharmacy or school, or they just out there playing around, getting in trouble? But I guess, what would you, if you were their keynote speaker, for their graduation, I guess, what would you say to encourage them as they're entering into high school?
Wow.
Not the whole speech, just like a couple lines.
I think the first thing that came to mind is keep an open mind. I think a lot of times we either don't know about pharmacy, or we say, I'm going to be XYZ. And you just go with that mindset, but there's so many other things that might spark your interest. You're just in eighth grade, like keep your mind open to different career possibilities.
I love that.
Yeah, open mind.
I wish somebody told me that, because I think I was so laser focused. We were in that group where we were just so determined, and I think it muddies the waters a little bit when you get to college, because you miss out on so many other courses that you could explore. It doesn't mean that you'll change your mind, but just the diversity of that experience. So now we got these 12th graders who have landed scholarships galore all over the place, and they're excited to go into their freshman year. And I feel like you'll say the same thing to them, but what else could we say to our rising college freshmen this year?
I would say try to explore different opportunities, whether that's shadowing somebody, volunteering. If you have a professor, say you're not in the engineering program, but there's a professor that you hear about in engineering, maybe try and go and talk to them, just see what they do as an engineer. Or if you have a friend of a friend of a friend who is, an architect, try and seek those different opportunities out to just talk to that person, and see, maybe you might like, that field versus this other field.
Oh, you nailed it. You nailed it, because you know what? I didn't even think of that, because as you were speaking, it was like the power of networking. You have no idea how your paths are going to cross again. So the people you go and do life with in college might be your future employees, your future employer, your future collab or a consultant. Like, you just don't know. And you know what? That networking has really served me well over the years. Just being able to pick up the phone, because I went to school with this person. Hey, I need the inside scoop. Or I need you to help me think this through. And I like also that you said, and this is something I didn't start to do until graduate school when I got to my MBA program. Somebody said to me, I said, well, I want to do this and I want to do that. And it was like, okay, if you want to do all these things, then you need to go take a job, like you said, or go shadow or go intern in this area to develop those skill sets. And so they was like, you want to do this, Ethel, but you didn't study finance. And I'm like, darn it. So now I got to go get a job in accounting. And so I can do healthcare finance, which I did. And I think it shows you if you really do want to do what you say you want to do. Because I realized very quickly, I was like, ooh, I can do my balance sheets, I can do all the finance stuff, but that's not something I want to do every single day, especially during texting. Like, yeah, I don't remember sleeping much. This ain't for me. But some people get really excited about that. So I think you nailed it. And now I'm going to stretch it a little bit more. So we talked about keeping an open mind. We're talking about networking, talking to other professors, just getting to know people just in their humanity. So now we got these college grads. Some of them are probably very stressed because they don't know what they're going to do. I don't know. The living situation might be uncertain. There's just a lot of things going on when we graduate from college or that first graduate program for those who are trying to figure it out. How can we encourage them? What can we say?
Take a deep breath. It's going to be okay.
Perfect.
It may not seem like it, but everything will fall into place when it's meant to be. I know graduating or completing my residency, it was very stressful because I'm like, I'm all the way here in Wisconsin. My apartment lease is going to be ending. I have no idea where I'm going to go next for a job. So I just kind of had to take that deep breath, keep looking at the job postings and, just kind of pray on it. And for those that are praying, but, just kind of taking that deep breath, it will be okay. And it's okay to stress out, but just come back to doing what you need to do to keep going forward or to go forward.
That's beautiful. And I love you summed it up quite well. And we're going to pray on it, y'all. For those of us that are finishing up this year, that is not me. I still have another year of clinical didactics and rotation stuff to do. But yeah, I think, thank you for saying that. So to our graduates, we want to say congratulations. Take that deep breath. Enjoy the moment, right? You don't get to hear pop and circumstance every day when it applies to you.
Yes.
So enjoy that moment, walk across that stage, just be in the moment. Like Alicia, Dr. Forbes said, we'll close out that way. Everything does fall into place. It's stressful because it hasn't happened yet. Right. God help us.
Yes.
So we hope that you have a better understanding of the world of pharmacy and ways that you can navigate your educational journey to get there. And just know it's never too late. You can always go back to school for it. I mean, the foundational courses are what they are. So we hope that you find a mentor. Maybe that's what we should be also saying. Find a mentor to talk it through. If you have any questions for Dr. Forbes, she's very busy, but we'll put her bio in attached to this video. You can certainly reach out to her via LinkedIn or whatever information she provides that's appropriate. We will make that available. But we encourage our students to form that community and just start having a conversation. Any final words for our graduates this year? For our rising graduates that's coming up next year?
No, I just think, kind of putting it all together, explore, open mind, networking, taking that deep breath. But you can do it. You can do it and you will do it wherever you are in your season of life.
Awesome. Well, you've heard it from one of the finest pharmacists I know in my generation, Dr. Alicia Forbes. Thank you so much for your time today. This has been another podcast experience within the kitchen with the Plant Based Nutritionista, where we are creating a community in health. to inspire you and empower you, not only to take your health back one meal at a time by eating more plants, but to own your healthcare journey. And so if you have questions or even of your physician about your medications, let them know and they can hook you up with your pharmacist on the team, is what I'll call them, your pharmacy team member. All right, guys, have an amazing day. We'll see you next time.